As a neurologist, I must tell you something many people do not realize. Stroke is one of the leading causes of death and disability worldwide, and yet the early symptoms are often dismissed or overlooked, especially in older adults. What makes this so dangerous is that a stroke can begin quietly, with subtle changes that seem harmless, before it suddenly becomes life-threatening. In the United States, stroke remains a top killer, and older adults are particularly vulnerable, with nearly 2 out of 3 cases occurring in people over the age of 65. The tragedy is that many lives could be saved if families recognized the warning signs earlier. Stroke symptoms can appear within minutes, sometimes even seconds, and they may vanish just as quickly. Numbness on one side of the face, a sudden trouble speaking, difficulty seeing, loss of balance, or a severe headache may not seem connected at first glance, but they are all possible signs that the brain is under attack. For women, additional symptoms such as sudden hiccups, nausea, chest pain, or shortness of breath can also signal stroke. These differences are important, yet they are often ignored until it is too late. The reality is that every minute counts. With each passing moment, millions of brain cells are lost, and the chances of recovery decrease. That is why awareness is the first line of defense. In this video, I will guide you through the most important stroke symptoms in older adults, explain why they are often missed, and show you what actions must be taken immediately to protect yourself and your loved ones. Before we continue, I want to ask you directly, have you ever witnessed a parent, a spouse, or even yourself experience sudden numbness, dizziness, or difficulty speaking that disappeared quickly? Share your story in the comments, because your experience may help another person recognize these hidden signs and act in time. 1. Common stroke symptoms in older adults. When we talk about stroke in older adults, the most critical step is learning to recognize the common symptoms that appear suddenly and without warning. These symptoms are the brain's cry for help, and ignoring them can mean the difference between recovery and lifelong disability. One of the most frequent and visible signs is numbness or weakness in the face, arm, or leg, usually on just one side of the body. A smile may suddenly appear crooked, an arm may not lift properly, or a leg may drag. These changes occur because the part of the brain controlling movement and sensation is no longer receiving enough oxygen. Another key warning sign is difficulty speaking. The person may suddenly slur words, have trouble forming sentences, or be unable to understand simple instructions. This happens because the brain's language centers are deprived of blood flow. A quick test is to ask them to repeat a short, clear sentence. If they cannot, even briefly, treat it as an emergency. Vision changes are also common. A person may suddenly lose sight in one or both eyes, see double, or experience blurred vision that comes on without explanation. This is a sign that the areas of the brain responsible for processing visual information are in distress. Balance and coordination problems are another signal. An older adult who suddenly feels dizzy, stumbles, or cannot walk straight may be experiencing a stroke. This is especially concerning if combined with nausea or difficulty controlling movement. Severe headache is one of the most alarming symptoms, particularly when it strikes suddenly and feels unlike any headache before. Known as a thunderclap headache, it often indicates a hemorrhagic stroke caused by bleeding inside the brain. This pain may be accompanied by vomiting or loss of consciousness. and it requires immediate emergency care. It is important to remember that these symptoms may appear quickly and sometimes disappear within minutes. This condition, called a transient ischemic attack or mini stroke, is not harmless. It is a red flag that a full stroke may be imminent. Sadly, many people dismiss these brief episodes, thinking they are nothing serious, only to suffer a major stroke days or weeks later. Recognizing these signs in older adults is especially urgent because age increases both the risk of stroke and the severity of its outcomes. Older brains are more vulnerable to damage, and recovery is often slower and less complete. If you notice sudden numbness, slurred speech, blurred vision, imbalance, or severe headache in yourself or someone you love, do not wait to see if it improves. Call emergency services immediately. Every minute that passes means more brain cells are lost, and with them, the ability to move, speak, and live independently. Stroke is a race against time, and knowing these common symptoms gives you the power to act before it is too late. 2. Stroke symptoms in women versus men. When discussing stroke, it is vital to recognize that symptoms can differ between women and men. These differences are often subtle, yet they play a critical role in whether or not a person receives timely treatment. For men, the classic signs are usually the easiest to identify. Sudden weakness or numbness on one side of the body, difficulty speaking, loss of balance, blurred vision, or a severe headache are the symptoms most people associate with stroke. Because these signs fit the traditional picture, they are more likely to be recognized quickly. However, the situation for women is more complex. Women can experience these same classic symptoms, but they are also more likely to present with unusual or less obvious signs. These include sudden hiccups, unexplained nausea, chest pain, shortness of breath, palpitations, or a general feeling of weakness throughout the body. These symptoms are easy to mistake for digestive issues, anxiety, or even a minor illness, which is why strokes in women are often misdiagnosed or treatment is delayed. This delay can be fatal. Statistics show that while men experience strokes at slightly younger ages, women are more likely to die from them. In fact, nearly 60% of stroke-related deaths occur in women, compared to 40% in men. Part of this difference is due to biology, as women tend to live longer and thus face a higher lifetime risk. But another part comes from the way symptoms are interpreted or overlooked. Understanding these gender differences is essential for families and caregivers. If an older woman suddenly complains of chest discomfort, sudden fatigue, or difficulty breathing, do not dismiss it as stress or aging. These may be early signs of a stroke in progress. Similarly, if a man shows sudden slurred speech or weakness on one side, do not wait to see if it passes. Immediate action is necessary in both cases. The challenge is that stroke symptoms often mimic other conditions. A woman with nausea may be told she has food poisoning, while a man with dizziness may be told he is dehydrated. That is why awareness and suspicion are so important. It is safer to assume stroke and seek emergency care than to risk waiting. Time is the most critical factor for both men and women. Treatments that dissolve clots or stop bleeding are most effective when given within the first few hours. Every minute lost reduces the chance of recovery and increases the chance of permanent disability. By understanding how stroke presents differently across genders, families can respond more effectively and save lives. For women, pay special attention to unusual signs such as hiccups, chest pain, or sudden breathlessness. For men, remain alert to the classic picture of weakness, slurred speech, and imbalance. Stroke does not discriminate, but the way it appears can vary. Knowing these differences is a powerful tool in making sure no warning sign is overlooked. 3. Types of stroke in older adults. To fully understand the threat of stroke in older adults, it is important to know that not all strokes are the same. Different types of stroke damage the brain in different ways. And recognizing these distinctions can help families and caregivers act quickly and effectively. The most common type is ischemic stroke, which accounts for nearly 85% of all cases. This occurs when a blood clot blocks or narrows an artery leading to the brain, preventing oxygen-rich blood from reaching vital areas. The clot may form directly inside a brain artery, known as a thrombotic stroke, or it may travel from another part of the body, usually the heart, and lodge in a vessel in the brain, known as an embolic stroke. In both situations, the effect is the same. Brain cells begin to die within minutes because they are starved of oxygen and nutrients. These strokes are often linked to conditions such as high cholesterol, atrial fibrillation, or long-standing plaque buildup in the arteries. The second major type is hemorrhagic stroke, which occurs when a weakened blood vessel bursts and bleeds into or around the brain. Though less common, these strokes are often more deadly. High blood pressure is the leading cause because it places constant stress on vessel walls until one finally gives way. Aneurysms, which are balloon-like bulges in weakened arteries, can also rupture and cause sudden catastrophic bleeding. Hemorrhagic strokes often present with an explosive headache, vomiting, or sudden loss of consciousness, and they require immediate emergency care. There is also a condition called a transient ischemic attack, sometimes referred to as a mini stroke. This happens when blood flow to part of the brain is blocked only briefly, often for a few minutes. Symptoms mirror those of a full stroke, such as weakness, slurred speech, or vision problems, but they resolve quickly. Many people dismiss these episodes because they feel better afterward, but that is a grave mistake. A transient ischemic attack is a serious warning that a larger stroke could occur in the near future, sometimes within days. Ignoring this sign is like ignoring a fire alarm. In older adults, all types of stroke carry higher risks because aging blood vessels are more fragile and recovery takes longer. While ischemic strokes may have better survival rates, the disabilities they cause can be severe. Hemorrhagic strokes often lead to higher death rates, but those who survive sometimes recover more fully. Understanding the type of stroke helps guide treatment and rehabilitation. But for families, the key lesson is simple. Do not waste time trying to determine which type is happening. Any stroke symptom should be treated as an emergency. Only trained medical professionals with brain imaging can confirm the type, and the sooner they act, the better the outcome. By knowing these categories, you will better appreciate why urgent action is essential and why prevention remains the most effective defense. 4. Recovery and care after stroke. Surviving a stroke is only the beginning of the journey. For older adults, recovery and long-term care are often as challenging as the event itself. A stroke can leave behind weakness and speech problems, memory loss, or emotional changes, and these difficulties require patience, medical support, and consistent rehabilitation. The first stage of recovery begins in the hospital, where doctors stabilize the patient and assess the extent of the damage. From there, a rehabilitation plan is created, tailored to the individual's needs. Physical therapy plays a central role. Exercises designed to strengthen weak muscles, restore balance, and improve coordination help stroke survivors regain mobility and independence. For those with difficulty walking or using their arms, regular therapy sessions can make the difference between relying on others and moving freely again. Speech therapy is equally important. Many survivors struggle with slurred speech, trouble forming words, or difficulty understanding language. Working with a speech therapist helps retrain the brain to communicate, often by using new pathways around the damaged areas. This process can be slow, but with persistence, meaningful progress is possible. Occupational therapy focuses on restoring daily skills. Simple activities such as eating, dressing, or cooking may need to be relearned. Therapists provide strategies and adaptive tools to make these tasks easier, helping individuals reclaim independence in their own homes. Emotional and psychological care should not be overlooked. Stroke can trigger depression, anxiety, or frustration, especially in older adults who suddenly face limitations. Counseling, support groups, and encouragement from family members are essential for maintaining motivation and mental well-being. Recovery is rarely a straight line. Some people improve quickly, while others take months or years to make progress. What matters most is consistency and support. Family involvement is critical. Loved ones who participate in therapy sessions, encourage healthy habits, and provide emotional reassurance greatly improve outcomes. At home, creating a safe environment is important. Removing tripping hazards, installing grab bars, and ensuring good lighting can prevent falls and accidents. A healthy lifestyle after stroke also reduces the chance of recurrence. Balanced nutrition, regular light exercise, avoiding smoking and alcohol, and keeping medical appointments all play vital roles. Medications to control blood pressure, cholesterol, or blood clotting must be taken exactly as prescribed. The road after a stroke is not easy, but it is not hopeless. Many older adults regain significant abilities and live fulfilling lives. The key is early intervention, continuous rehabilitation, and unwavering commitment to care. Think of recovery as a second chance that must be nurtured every single day. Stroke may steal strength and speech in an instant, but with proper care and persistence, it does not have to steal the future. 5. Doctor's final words. As a neurologist, my final message to you is this: stroke is not just a momentary crisis. It is a life-changing event that reshapes both the patient and the family. The tragedy is that many strokes could be prevented or treated earlier if the symptoms were recognized and acted upon without hesitation. Too often, people ignore warning signs such as sudden numbness, trouble speaking, or vision changes, hoping they will pass. Others fail to realize that unusual symptoms in women, like sudden hiccups, nausea, or chest pain, may also signal a stroke. Every delay costs precious brain cells, and once they are gone, they cannot be replaced. That is why awareness and rapid response are the most powerful tools we have. If you ever see these signs in yourself or someone you love, do not wait. Call emergency services immediately. Quick action can mean the difference between full recovery and lifelong disability. For those who have already faced a stroke, remember that recovery is possible. With rehabilitation, emotional support, and a commitment to healthier living, many people regain independence and continue to live meaningful lives. The journey is not easy, but every small victory is a step toward reclaiming strength and dignity. Stroke prevention and recovery are lifelong commitments. Eat wisely. Stay active. Avoid smoking and alcohol. Manage your blood pressure and diabetes. And keep regular appointments with your doctor. These steps may seem simple, but they are powerful shields protecting your brain. I encourage you to take this message to heart and to share your thoughts below. Have you or someone you know experienced any of these symptoms or faced the challenge of recovery? Your story may help others act in time and may even save a life. Stroke can steal speech, mobility, and independence in a matter of seconds. But awareness, prevention, and care can give you back years of strength and clarity. The choice to act is in your hands, and the time to act is now.